Thanks for joining us. A crisis of care. Today, the Arizona Department of Health and hospital leaders from across the state issued a plea to the public for help against COVID, which is once again surging.
COVID-related cases, deaths, hospital bed usage, and ventilator usage are all at the highest levels the state has seen in the past 6 months.
Team 12's Josh Sanders was there. And Josh, what was their message?
Well, the message was, we are at war, and right now hospitals across the state are experiencing the crush of unvaccinated patients. A sense of urgency and plea for help from the state's top COVID-19 fighter and hospital leaders across the state.
What we're doing today is pleading with that American that it's not about you, it's about you, your family, your community, our state, the nation, and the world.
50% of our patients in our ICUs are on ventilators today at Banner Health are COVID positive. If we didn't have those patients, we would have more than enough room for all the other patients that we're talking about that need us today.
Statewide, only 35% of emergency beds remain open, 8% of inpatient beds, 6% of ICU beds. In just 5 days, COVID-19 intubations are up 61%.
Seeing the data over the past several weeks that there's another wave on its way. What works, what is shown the highest level of effectiveness to protect people is the vaccine.
While that may be true, Governor Doug Ducey has opposed vaccine and masking mandates. Meanwhile, Arizona hospitals are suffering.
Will vaccine save Arizona? No, it's too late for that. We're too far in.
University of Arizona Public Health Director Dr. Joe Gerald tracks the state's COVID-19 numbers and echoes Carmona's plea for the public to be vaccinated. Even though the damage from unvaccinated people has been done, he says Arizonans must also practice what we know.
Right now, it's the non-pharmacologic interventions that are going to have the most impact. Mask wearing, avoiding high-risk areas.
Gerald expects cases and deaths to rise through the next 4 to 6 weeks and expects COVID-19 to be a seasonal burden for hospitals for the next 2 to 5 years. But he says there is hope if there's public buy-in and with the development of oral treatments for COVID-19. Right now, Carmona's message is clear to the public. Help us, help each other.
Even with the best ideas, we can't do it without the public helping us.
Josh Sanders, 12 News.
All right, Josh, thanks.